Welcome to our community forum, and today the focus is on gluten intolerance and how food sensitivities and other allergies can impact mental health and addiction recovery. It looks like we have some returning students as well as some new community members. So I would like us just very briefly to introduce ourselves and tell just one sentence where you're from and what your interest is in this topic. I will start. Most of you know me, but some of you don't. I am Christina Veselak. I have been a licensed psychotherapist for over 35 years, working in the addiction field for that long. And I'm also a certified nutritionist specializing in applying mental health nutrition to addiction recovery. With that, Gary, is it Gary or Jerry?
Hi, yes, it's Gary. Thank you. I came into recovery over 27 years ago. I had a great interest in nutrition at that time. I'm a registered holistic nutritionist since 99, and I started working in rehab centers 20 years ago, and it was very clear from my own experience and so many people that I encountered that gluten was not to be included on our daily meal plans. So I would like to know if there's any research other than the little bit of data that I've collected that because everyone's looking for scientific proof, if there's any research that I could look to while trying to convince people who aren't really willing sometimes to just even take a week to do a little experiment on themselves, just a little motivation push. So that's mostly while I'm here. I'm already converted, but I would like more information to share.
All right, thank you. And where are you located?
Oh, I'm currently in Ontario.
Ontario,
Canada.
Great, in Canada.
Yeah.
I was born in Toronto.
Oh, me too, yeah.
Yeah. You know, there is some research, and I'm not really going to be talking directly about the research, but I will get that. What we have, I'll get to you.
Thank you so much.
Yeah, and when I'm going to be spending a few minutes just describing the whole situation, and then when I'm done, I'm going to be asking for success stories. So if you have any, I'd love to hear from you.
Besides me? Yeah.
You and anybody else.
Right, okay. Thank you.
All
I may
right.
have to leave. That's why I had sent an email wondering if this was being recorded because I'm on Eastern Standard Time and I was thinking that it was an hour later. So my schedule is a little tight, but I hope to listen to the recording after if I have to go.
Great, and it will be recorded and posted on YouTube.
Thank you so much.
Glad to have you with us. Okay, Jenny.
Hi, I'm Jenny, and I'm in the Christina's Level 2 course, and I'm interested in this because I know a couple people close to me that I think this information would be really useful. So I'm excited to hear what you have to say, Christina.
Thanks, Jenny. And Jenny lives in California.
Yes.
Mark.
Yeah, I'm Mark Stiles. I'm just outside of London in the UK. My last 25 years has been working with families and working out what the recovery journey is for adults and families. So I'm specialising in unintended my goal is to work with people that up to their loved one, recovering through and beyond our first 5 years of remission. I came to the academy a couple of years now. Yeah, just sort of so much of what I do. I kind of wish I'd found the academy over the 13 years that I was running treatment clinics, but alas, I didn't. But hopefully, if we can help some other treatment centres to get the benefit that I missed out on.
Thank you, Mark. Mark's connection got a little iffy. So for those of you who didn't really hear, he has done a lot of work coaching families into recovery and into helping their loved ones into recovery. He's also spent many years working and directing treatment programs. He is currently our marketing director and our collaborations director. So some of you know him through his helping you build and expand your practices and your influence reach. So please reach out to him if you want support in that direction. Lisa.
Hello, thank you. Good morning. My name is Lisa Young. I am out in Colorado, and I am a level 2 graduate. And I think if we keep it short, I'll just say my primary focus was trauma recovery. And when you see trauma, you often see addictions. And so that sort of led me down this path. And I love being able to add both to the more full recovery. I currently work with emergency responders as sort of a sub group that I am I've been specializing in for the last 4 years.
And they need a lot of help with nutrition.
Yeah.
Yes. Thank you, Lisa. Laura Lee.
Good morning. Can you hear me?
Mm-hmm.
Hi, I'm Laura. I'm out in Oklahoma, and I am doing my internship with Level 1 right now with the Academy in Christina. Gosh, I've learned so much. And my background is I have a bachelor's degree in biology. I'm certified in yoga and aromatherapy and just about every natural healing modality that I could get my hands on. So I'm just excited about the future. I've been talking to my friend Shannon, who I've been friends with for about 12 years now. She moved out to Maui, and she wants me to come start a retreat there, a recovery center on her fruit farm in Maui. So we'll see how that unfolds in the future. So lots of doors opening in my life, and I'm really excited and thankful.
That would be amazing, Laura. Thank you.
All right. Thank you.
Amira. Unmute, please.
Hi, this is Maternan.
Oh, okay. Amira,
Oh, Amira.
but you need to unmute.
Can you hear me now?
I can, yes.
Perfect. So my name is Amira. I'm currently living in Wisconsin, and I joined the Academy after hearing about, I don't know how I got down this direction, but now I know. I got referred from Julia Ross's clinic.
Yes.
So that was something I had been looking into about 10 years ago. So this has just been a long, winded journey of how I'm coming back to where I was 10 years ago. So it feels really, really good. I have my master's in counseling psychology, holistic, somatic. So somatic is like a really, really cool subtype of counseling psychology. I would encourage everybody to kind of like take a peek at that and what that means, and the significance of that in addiction recovery. So I'm also a nutritionist, and I'm just excited that I finally get to do what I've been wanting to do for a while now. So I'm really glad to be here. So thank you for having me.
Well, you're welcome. And welcome. I'm just going to shut my door. Deborah?
Hi, everybody. Deborah Filla here in KC, and I was looking for Christina for a long time to help me understand if this is a disease, what's stroke, and how do you fix it. And along the way, before I got to find Christina and attend level 1 and 2, we also, when I did three city seminars, which were quite fun. But I had a daughter get alopecia, and at the age of 16, lost all her hair, eyelashes, and including nose hairs. And so I got into looking at autoimmune diseases, found out we were all gluten sensitive, and what a difference that has made. I think if you're going to get one disease, that's the one to get, because people think it's like like the end of life if they aren't going to be able to eat wheat. But on the other hand, it is the simplest one to cure. So with that blessing, I look forward to hearing and talking to you more, because it's all about the gut.
Thank you, Deborah. Mother name, or however you pronounce your name. Sorry if I mangled it.
That's okay. It's Mutter Nan.
Mutter Nan. Okay.
My name's Mutter Nan, and I'm coming in from Napa, California. And I found Christina through Julia Ross as well. I did amino acid therapy with Julia for my son 10 years ago. So I've been dabbling in aminos for a very long time. I'm a licensed psychotherapist and a 22-year practice. I am looking to learn new tools to add to my toolbox with clients. And I do know a lot of my own self-learning, but I'd like to learn more traditional and more in the schooling sense. So that's why I'm here. And the reason I joined today's call is I was intrigued about the link between gluten and alcoholism.
Yes.
I found that interesting. I hadn't heard that before, but then as I thought about it, it makes sense. So I'm looking forward to hearing more about that. Thank you.
Great, thank you. And by the way, Jenny is also in the Napa area.
Oh.
Right, Jenny? Yeah.
Are you a therapist? Okay, well, you can message me. I'll message you. Thank you.
Jeff, let's keep it short, everybody, because we want to jump into the meat of this.
Okay, sure. My name is Jeff Jones. I'm in Lafayette, Colorado. I'm a therapist, and my focus has been working with families for about a decade. And I've known Christina for maybe 8 years and started her level 1 class then and dropped out of it because it was too much, and dabbled with aminos since then. And currently I'm in Christina's level 2 course.
But he made it through level 1.
Yeah. Yeah. And a couple months ago, I dove deep into Joan Matthew Larson's alcohol biotypes thing. I did a webinar in June in that. I'm having another one later this month. And yeah, I'm very passionate about the whole enabling health as opposed to enabling old patterns that reinforce addiction. So yeah, I'm glad I'm here.
Great, thanks, Jeff. Losa.
Hi, I'm Valsa Madhava. I'm a addiction physician, MD physician. I'm also a functional medicine doc, and I treat addictions and mental health using supplements and aminos and functional medicine testing. I am in New York, where we have limited functional medicine testing.
Very limited, but you can get creative. Welcome, Valsa. Eileen.
I don't know how to make myself appear.
That's okay. You can just introduce yourself.
Okay. Good morning, everybody. My name is Eileen Hokkopian. I am currently in level 2 of Christina's Academy, and I am delighted to be here and to get connected to so many beautiful, talented healers on this planet. I am a clinical nutritionist, a registered dietitian. In the past, I have worked in many facilities and I've had my own personal practice. Now I mostly practice virtually, and I basically work with body biochemistry and lifestyle, therapeutic lifestyle modalities. I do personalized nutritional care and personalized menus and food plans, and I am delighted to be here.
Thank you very much, Eileen. We're glad to have you here as well.
Thank you.
Jacqueline.
Good morning. I am in New York City. I am a somatic experiencing practitioner and a functional medicine health coach. I work with families who have experienced trauma, often but not always in the adoption community. And I use aminos with my clients as well as family members, some of whom have identified, including myself, an intolerance to gluten. And so I am very interested in how these things all synergize with mental health and conditions such as mast cell disorders, which are histamine based. And I have followed Christina from afar for a long time, and I'm always amazed by the really talented and diverse groups of people that she brings together. So thank you. I'm very happy to be here.
Delighted to have you, Jacqueline. Thank you. Tim Nolan. Tim, do we have you? Yes.
Yeah, okay. I was working, checking my emails. I was multitasking. Anyway, I'm a person that's been long-term recovery. It was 50 years, January 11th. And I turned 80 March 21st. But I attended a nutrition class at Recovery Church in St. Paul, and just started reading labels. Made a big impact on my life. I don't get on those factory farm aisles in there anyway. But I went from a 38-inch waist down to a 30, and I maintained more or less. It's kind of like the Mediterranean diet, the 5 fruits and 5 vegetables, and it's just we are what we eat. And part of I go for a walk every day for 1 hour, then I have nutritious breakfast. But it's just we are what we eat, and there's so many people are still addicted to caffeine and nicotine. Nicotine is because it's cured with sugar and it's preserved with formaldehyde, which makes it carcinogenic. But it's just that, and it's just something I left funeral service in 1985 with another degree, and I worked in behavioral health. And I was my 4th promotion at St. Luke's in Arizona, working with impaired physicians. I was by a room full of doctors and dentists. They were writing their own scripts. They got hooked on amphetamines when they're medical school, dental school. But anyway, I'm at 80. I'm still a work in progress, and I'm very active in the community. I worked with the legislature when we were allowed to go.
Okay, Tim, I hate to interrupt you, but we need to move on here. But thank you so much for joining us, and congratulations on 50 years of recovery.
Thank you.
Okay, Emily. Unmute and just briefly.
Sorry. Sorry, I was a little late. I was getting to FaceTime my son. So are we just introducing ourselves and kind of giving a brief?
Very brief introduction.
Okay. So my name's Emily, and I am in Christina's level 1 now internship, and loving it, and having a lot of success with my clients. And I'm just so happy to be a part of this community.
Well, welcome. And I think you're also a yoga coach, right?
Yeah, I'm a yoga instructor, yoga coach. I'm a registered psychotherapist, unlicensed. What else?
And you're in Colorado.
And I'm in Colorado.
All right. Thanks, Emily.
Yes.
All right. Let's jump in. Thank you all for sharing. I like doing this. I know it takes up a bit of time, but one of the things the Academy is very committed to is networking and community building, and building connections between practitioners in different parts of the country. So I hope you can all start getting to know each other. We've got several Coloradans, we've got several New Yorkers. So great opportunities here for collaboration. Okay, gluten intolerance. Those of you in my advanced class, this will be just a little bit of review, but review is always good. I stumbled into awareness of gluten intolerance the hard way, like I think most of us do. When I was 30, I was barely functioning. I had severe chronic fatigue and fibromyalgia and pain and I'd actually been ill my whole entire life, and my mother had taken me from doctor to doctor and they couldn't find anything wrong. And they decided that there was something wrong with her and that I was perfectly okay. Well, I wasn't, to the point that even though I had intended to go into medical school as soon as I graduated from college, by the time I got there, I was too physically ill to make it through. I simply didn't have the stamina. And that was a deep grief for me for a very long time, until I realized I'd come in through the back door. So when I was 30, I met Julia Ross. I read a press release about her center in the San Francisco Bay Area and went to meet her and her nutritionist. And I was so impressed by the nutritionist that I made an appointment to see if she could figure out what was wrong with me. And after a couple of false starts, she said, you know, you don't have all the symptoms, quote, of celiac disease because I'm overweight rather than underweight. But why don't you go off gluten for 5 days and see what happens? So I went off gluten for 5 days, and on day 5, my life turned right side up. And I felt alive for the first time in my whole entire life. And so I called my mother and said, Mom, my nutritionist thinks that I might have celiac disease. And there was this dead silence on the phone. And she said, oh, you were diagnosed with that when you were 2 years old and you almost died from it. But I've never heard about gluten. So when I was 2 years old, the disease celiac sprue was identified. But at that point in time, they had not made the connection to gluten or an inability to digest gluten. And so the diagnosis for me got completely lost. And it wasn't until this brilliant nutritionist figured it out 35 years ago that my life got on the right track health-wise. So that's a very, very brief story, but I think it illustrates what happens to many, many people, because there is a lot of confusion as to what this disorder actually is. So I'm going to start by talking about the basics, clarifying kind of 2 ways of getting there, and then specifically why and how it can impact addiction and mental health. So when we talk about gluten intolerance, whether or not somebody has the genetic disorder celiac disease, we're talking about the body's inability to produce sufficient digestive enzymes, the very specific digestive enzyme that digests gluten and the protein found in milk, casein. And if we don't produce enough of this digestive enzyme in our small intestines, the gluten molecule that is found in tiny amounts all over the place, but in significant amounts in 3 grains, wheat and the entire wheat family, so that includes spelt, rye, and barley. These are foundational grains for the Western world. Oats do not contain dangerous amounts of gluten. However, they are processed on conventional machinery in factories where wheat and other gluten-containing grains are processed. And very often in the meals, in the fields, a lot of barley, wheat, and rye seeds may get mixed in with the oats, and so it's contaminated on the field level as well. This is why commercial oats are considered a gluten-containing grain, even though by themselves they're not. And I'm not going to get into all the complications, but I want to keep this really simple. So really simple, it's 3 grains, and commercial oats are the big culprits. And it's specifically the gliadin portion of the gluten protein in these grains that need to be digested. And if they aren't digested, well, if they're not completely digested, they're partially digested into something called peptide chains. So peptide chains are chains of amino acids that aren't big enough to be full proteins because they've been broken down, but they're still not in the component amino acid form. So when we have gluten intolerance and these partially digested peptide chains, there's a number of biochemical processes that occur leading to what's called leaky gut or intestinal permeability or inflammation of the cells lining the intestines, allowing these peptide chains to get into the bloodstream. Now, they're not supposed to be there. So the body immediately tags them as not self and mounts an immune response. Well, wherever these then complexes, immune complexes, the antigen and the antibodies forming to them settle, it's going to cause symptoms. So if they settle in the joints, you're going to have joint inflammation. There is a way by which they cause skin inflammation. They can cause a number of physical symptoms, but they can also get through the blood-brain barrier. Whenever apparently we have a leaky gut, we also have a leaky blood-brain barrier. So things can get into the brain that don't belong. And some of the things that get into the brain that don't belong there are these peptide chains. And they have been known to attach to neurotransmitter receptors, such as the endorphins, serotonin, GABA, some of the others, and fire them, causing symptoms. And this is one of the causes of mental health disorders as a result of gluten intolerance. I'll specifically talk about celiac disease in a minute. But the end product, however you got there, is these peptide chains ending up in the brain, attaching to receptor sites, causing symptoms. This has been known for a while in the autism community. And a lot of people with autism, both children and adults, find that they do so much better when they go gluten-free and casein-free. There is also an autoimmune reaction that is set up that causes inflammation both in the gut and throughout the body. And some of the symptoms as a result of this process include every single psychiatric symptom in the book. And there has been quite a bit of research and needs to be more on the different psychiatric disorders that are created by gluten intolerance. So we have all of your psychotic disorders. We have schizophrenia, schizoaffective disorder, bipolar disorder, ADHD, OCD, anxiety, depression, and then just plain fatigue. So my gluten intolerance symptoms were and continue to be deep, profound fatigue, joint pain. I don't really have the skin issues that some people have, and depression, but my fatigue was so deep that it got in the way of me wanting to interact socially. I didn't have any social energy. Those of you who know me now think, really? But back then, you know, socializing with people was very difficult for me for a number of reasons, but one of them is I simply didn't have the energy. I remember being in college and seeing a group of girls. I was in the cafeteria, and there was this group of 3 girls that walked in on the other side of the cafeteria through the door and sat down in a booth. And I so wanted to get up and join them, but I was too exhausted to literally get up out of my seat, walk across the room, and say hi to these girls. So lots of ways that this disorder has really destroyed lives. Now, the difference between gluten intolerance and what's called celiac disease is that in celiac disease, genetically, we are not capable of making the enzyme necessary to break down gluten. In gluten, and there are genetic tests that can identify your susceptibility to this. For everybody else with, quote, gluten intolerance, there could be a number of factors at play. One factor is that you're simply not making enough enzyme because so many of the foods we eat are gluten fortified. And the gluten-containing grains are genetically modified to contain even more gluten. And so we can reach gluten overload. And these people find that they can tolerate a little bit, but if they overload it, they get into trouble. And there are some enzymes on the market that you can buy, and they're most useful for this category of people when they kind of overdo it and they know, I just want to, go out and have fun today. If they take the enzymes, they do much better. People with full-blown celiac disease, taking the enzymes will certainly help, but they're usually not sufficient. Some people find that they cannot digest the genetically modified wheat and grains, but are perfectly okay with the heritage grains, with the non-GMO grains. And so that they can't tolerate baked goods here in this country, but they do fine in Israel or in the European Union or elsewhere. And that's a very, very interesting experience for some people. Some people go so far as to import their flour and import their bread so that they can still enjoy things. Then we have the issue of glyphosate. And glyphosate, as all of you know, is found in the pesticide chemical Roundup. And it's everywhere, and it's on all of our food pretty much. And it sort of looks like our grains are doused in it. It's probably overstating the facts a little bit, But most of our conventional grains are not only genetically modified, they are also doused in glyphosate. Well, research has shown that glyphosate by itself can cause the same type of destruction in your intestines as celiac disease. And so it by itself is a profound gut disruptor. It disrupts other things as well, but it's a gut disruptor. So what are we really looking at when we talk about that? Well, with celiac disease, there is an autoimmune reaction in the small intestine that destroys the efficacy of the intestinal cell walls to receive nutrients and pass nutrients through into the bloodstream. I'm not going to get too technical here, but you can look at pictures of healthy cells that have cilia and a brush border where we have enormous surface area in our intestines to absorb nutrients. Enormous surface area. But with celiac disease, that surface area gets broken down into very, very little, which means that very few nutrients are getting absorbed into the body. So not only are these peptide chains running around creating havoc and getting into the brain and creating havoc, many of our necessary nutrients aren't getting into the bloodstream. And people have been known to literally starve to death. This is why, this was what was happening to me at age 2, but also why the diagnosis got lost for so long, because up until recently, it was assumed that therefore that everybody with celiac disease just ends up skin and bones and is profoundly malnourished. Well, some of us, when we have nutrient deficiency, and I certainly did for my entire life until the age of 30, some of us pack on fat. You know, it's this genetic thing where if your body's in famine for a long time, you know, whenever you can, you're going to create fat just to protect you from the famine. Well, my body apparently was in famine from the age of 2 because I continued even though I got out of the hospital, nobody had told my mother to keep me away from gluten. So I grew up eating like everybody else does and became very, very, very nutrient deprived. So that was also one of the contributors to my profound fatigue. It's also the reason why I personally needed to be on supplemental nutrients, the amino acids and vitamins, etc., for much longer than most people need to. We talk about how in some people, they only need to be on amino acids for 8 months to rebuild neurotransmitters and your body can keep it running from there. I needed to be on amino acids for 10 years because I was so profoundly depleted and because I had a lot of PTSD from a bunch of trauma that had happened. And I was continuously in a hyper-aroused state. And so I was, you know, using up nutrients by the gobs because I was in sympathetic arousal so often. So the longer people have been nutrient deprived, the longer it takes to rebuild our tissue stores. The final piece I want to share before we get into a discussion is that both Julia Ross and Joan Matthew Larson have discovered empirically in working with people and not cows, we're working with general clients as well as people within native populations, that there is a very significant subgroup, and there, as far as I know, there's been no actual research done on this, and there certainly needs to be, but there is a very real subgroup of people with alcohol use disorder who cannot stop drinking while they are still eating gluten. And I'm not sure that we understand all the reasons for this. I think it has to do with an autoimmune-based craving process that's set up. But whatever the process is, people, while still eating gluten, continue to drink. So I had one client, and I've got a couple of dramatic stories regarding him, but the story I'll share is once he and I really started working together, he said, yeah, I actually had a period of sobriety. It was several years back, and it was for about 2 years, and it was amazing. And then I relapsed, and I just can't stay sober. And he was in the process of losing his job and losing his marriage and everything behind his alcohol use disorder. So we were chatting about this, and one of the questions I always ask in my intake is, have you ever gone gluten-free, or does anybody in your family have celiac disease or gluten intolerance? It's a screening question. And he said, you know, funny about that, my sister was diagnosed with celiac disease several years back. And in fact, she even talked me into going gluten-free for a couple of years. I said, what was that like? He said, you know, I don't really remember, but I think it was really good. My digestion improved and I had more energy. I said, by any chance, was that the same 2 years that you were sober? And he counted back in his head and he said, yeah, it was. So my very first recommendation to this rather desperate gentleman was to go completely, utterly gluten-free again. And by the way, when you're gluten-free, you know, if you're significantly gluten intolerant, you have to be 100%. Even a tiny bit will set off reactions. I had another client who was so gluten intolerant that all he had to do was hold a pizza box and breathe in the flour that just, you know, is in the air and lands on the pizza box. And one of his gluten intolerant symptoms was vertigo and muscle weakness, and he just fell to the ground holding this pizza box. His reaction was that severe, and there's not that much gluten in the flour on a pizza box. We're not talking about eating the pizza. So anyway, this gentleman went completely, utterly gluten-free and found it much easier to stay sober this time. He'd been through treatment. He had all the skills. He knew how to do it. That for him was the missing link. So he had no problem with it. He was thrilled. But then one day he came in and he told me that he was okay, but that he'd really struggled over the weekend because he had gone backpacking with some friends in the Colorado mountains. And he wasn't in charge of food, and he hadn't pre-planned sufficiently, which all of us with gluten issues, we have to plan ahead impeccably, because otherwise we're going to be left in the situation he was left in, where his friends who were in charge of food brought cookies and sandwiches. And that was pretty much the extent of the food they brought for this couple of day backpacking trip. So he ate gluten. He didn't feel very well, but that was okay. But where the rub came was when they got back into town and they were walking down the street towards the hotel, and they walked past this bar and it called his name. And it called his name really, really, really loudly. Now, when he was leaving on the backpacking trip and walked past the same bar, he didn't even notice it. But coming back on gluten, walking past this bar, he reported he actually stopped in front of the bar and looked at it and thought, I really want to go in. I really want to drink. I really want to get drunk. Oh my God. what's happening to me? I really want to go into this bar. And this little voice in his head said, dummy, you've been eating gluten all weekend. What was it that that counselor of yours said? So here's what you're going to do. You're going to turn around and walk to your hotel room, and you're not going to eat any more gluten, right? And so he managed to not go into the bar and walk back to his hotel room and reported this whole story to me the next day. And he said, you know, if I hadn't realized that it was gluten, it would have felt that that craving was just coming out of the blue. And I would have gone into the bar. He said, so thank you. So just a reminder for everybody, cravings never just come out of the blue. They may feel like they do because you don't have enough knowledge to identify what the craving trigger was. But in my experience, if you really understand the biochemistry of this, you can always find what the trigger was. And in this case, it was spending 3 days eating gluten. And of course, there was, I don't think they brought any alcohol with them. I think they were all alcohol free. So he didn't have exposure to alcohol up in the mountains during the trip, but the moment he got back into town and walked past the bar, there it was. I have had another client who was married, unfortunately, to an Italian chef who really liked to cook her different pasta dishes. He was quite narcissistic, and he really didn't like her using rice pasta because he only wanted to serve her the best imported Italian pasta, which unfortunately still had enough gluten that it would trigger her drinking. So she would be alcohol free for a while, and then, you know, she'd think, oh, I guess I could get away with it. And he'd be pushing this lovely Italian meal on her. And she'd have it. And the next morning she'd go out and get herself rip-roaring drunk. Well, she was also clearly allergic to alcohol. So when she got rip-roaring drunk, she would also always inevitably do something outrageous that got her arrested. So now she'd be sitting in jail. Not 100% of the time, but like 90% of the time, she ended up in jail. And her relationship with her husband was the real issue. And we kept working on it and really couldn't shift it much. So this dynamic kept on happening. And it was really tragic. Last time I checked in with her, however, she had sort of figured out how to avoid gluten and therefore how to consistently and continuously stay sober, because she also had all the skills in the world. It's just that they didn't work the day after she ate her pasta. All right, that's our basic introduction. And now I just wanted to open it up to people who have other information, to stories, to questions. Let's have a community discussion here.
Hi, Deborah here. And because of my daughter's alopecia, I got involved with the celiac group here for a couple of years. I was the VP and did their speakers. And one of the things that when I went to one of the conferences, that there's two kinds of celiac that they call silent or atypical, which Christina described. And then there's the, the classic or typical like Christina's. And then there's the second kind they call the silent or atypical. And in the 2004 National Health Conference, where they gathered and looked at everything, and they came up with the understanding that the second kind, silent, which has no GI systems, but is the autoimmune, the malabsorption, and often anemia and osteoporosis or osteopenia are the two first signs of malabsorption, according to their conference. And that now was the most prevalent kind of celiac. And people would typically get it between 40 and 60 years and spend 9 years trying to get diagnosed. And I thought that was an interesting, I don't know if those numbers have changed, but one other thing is that it has been called the bread disease for schizophrenia have been interchangeable at different points in history.
That's right. Thank you. Thank you, Deborah. Yes, indeed. And in fact, until I finally got diagnosed, I had had no GI issues at all. Very interesting. By the time I got diagnosed, I had soft stools and that was it, but no other symptoms. One of the things that I forgot to mention is one of the reasons why this causes psychiatric symptoms is because of their profound nutrient deficiencies. Our brains require specific nutrients to function and to function optimally. And our brain requires enough of those nutrients to function optimally. So if we are long-time nutrient deprived, no matter how much we eat, because we're not absorbing it, our brains are not getting the nutrients they need to operate optimally. And then depending upon other genetic SNPs and kind of the basic terrain, it's going to show up as different symptoms in different people. But the underlying driver is this profound nutrient deficiency. So the brain just simply cannot function. All right, other stories or comments?
Christina, it's Laura. Can you hear me?
Yes.
What about Ezekiel Bread? This is something that I've been using, and it's sprouted grain bread. Are you familiar with this bread?
It still has gluten in it.
It does? Okay.
Yep.
Energetic. It seems to agree with my system more. And I was just wondering, since it's sprouted grains, if that helps the the body to recognize it and digest it.
Yes, it absolutely does. There's a lot of benefit with sprouted grains, and the sprouting process actually allows more enzymes to be produced in the grain itself that supports the digestion. So people without gluten intolerance, may still do better on a sprouted grain bread. However, the protein in the grain is still there. It's not like the sprouts of, it's not just the green sprouts. There's still grain there. You wouldn't be able to make the bread, right? You can't make bread out of barley grass. So it's still enough to set off anybody.
Okay.
Yeah.
Thank you.
Okay, so who has personal stories about gluten?
I do.
Hand up.
Jacqueline.
Hi. Yeah, so I have a personal story and a question about a client, if that's okay to ask.
Absolutely.
So the personal story is that for me, I decided to try going both gluten and dairy free several years ago, mostly because I was asking my clients to experiment with it and I hadn't. So what I was amazed to learn when I did that was that fatigue that I had attributed to menopause was in fact significantly alleviated, I would say almost eradicated, by going off of gluten. And I did on and off several times in order to be sure that I was not talking myself into something that didn't exist. And so that was 4 years ago. And the gluten impacts me personally more than the dairy. But I know for some folks, it can be similar, but that was quite an eye-opener for me. So suggests that experimentation in this way might benefit a lot of people who haven't even had it on their radar.
Exactly.
The question I have about a client is a young woman who I suspected might have anxiety related to gluten. And I asked her to experiment, and this was right before she was leaving for college. And when she did, her anxiety levels went up so much during what I am now calling withdrawal period, that in front of me, I had her, she was so overwhelmed and was sure it was the gluten. She ate a piece of bread in front, and this is a very level-headed young woman. She ate a piece of bread in front of me, and within 20 minutes was feeling back to herself. And I said, okay, what we have just learned is that you absolutely have a gluten intolerance. And she made the decision that she could not begin school going off of gluten because she didn't know how long the withdrawal period would be. So now she's back and is considering retrying this because she's not in school right now. And my question is, for those who have really severe withdrawal periods, and I'm assuming,
3
maybe
days.
wrongly, but assuming that it's opioid related in the system, what are there aminos or other methods that you would recommend to ease that transition period?
Yes, but the other thing I would do is reassure her that there's a 99% chance she's going to be completely over withdrawal within 3 days.
Okay.
Okay, that all she has to do is grin and bear it, although we can bring in aminos, and I'll discuss that in a minute, but she can tolerate it for 3 days.
Okay. This may have been the 4 or 5 day mark when we tried this before, but that has to be an average of 3 days. So maybe I would say a week.
Well, because typically it takes 4 days to get an allergen out of your system. Okay, so typically the withdrawal symptoms are worse on day 2 and 3 and can be very significant and can very often make people, want to go back to it. But they have to push through. So most people, and notice I'm not saying all, most people feel significantly better on day 5. Okay, there are other people for whom it just simply takes a whole lot longer. And there's a variety of reasons for that. It could be that she was using the gluten to fire her serotonin and GABA. And, she was actually using it as an addictive drug.
Yeah.
And her body was reacting to it by firing and therefore depleting the GABA and the serotonin. So even after the 4-day mark, when the gluten was gone, or at least the majority of its effect on the body was gone, because it can take months for the tissues to heal. So there can be extended symptoms just because the tissues have been damaged and take a while to heal. But in this case, it sounds like her neurotransmitter systems had gotten really significantly depleted, and she was using the gluten actually as a substance to fire those neurotransmitters so that she could function, but thereby continuing to deplete them, as with all addictive substances. This is what tolerance is. So she had developed tolerance to her gluten and needed enough of it to keep those neurotransmitters firing. She stops the drug. With any drug, we go into withdrawal and then post-acute withdrawal because our neurotransmitters are still so profoundly depleted. So I think if this was after that 3-day period, Jacqueline, she was in post-acute withdrawal due to depleted neurotransmitters. Therefore, what you do is you bring in the amino acids.
Okay, that makes sense. And have you seen either 5-HTP or L-tryptophan work better in this case, or is it really still very individual?
It's still really individual. You know, you still want to go with 5-HTP can be a little more activating than tryptophan. Tryptophan can still be a little more sedating. Okay, well, I'll get you in a moment. And so, you know, you want to see what works best for them. But this is where I would use the amino acid therapy chart, Jacqueline, because it might not just be serotonin, it could also be low GABA.
Yes, I think we have used the chart, and I think GABA would also be part of the picture. And would you start one and see the response before adding the other if you think it is multi-factor?
It depends on how much distress she's in. Sometimes I will just bring in with everything that's indicated because we just need immediate relief, or she's going to relapse back into gluten.
Yeah.
Right? She's just not going to be able to maintain off it. Mud or non?
Mud or nan.
Okay. I get it. I get it.
Okay. Well, non means bread and nan means eyes. So mutter means sweet or honey. I'd rather be honey eyes than honey bread. Though honey bread is pretty yummy, but it's full of gluten.
Okay, I'll remember.
Just to add, I know I'm new to this group here, but would you suggest L-glutamine?
Well, so then I would suggest whatever it takes to heal the gut. And so glutamine, because that's probably not a blood sugar issue.
No, but for the craving, because I find that with gluten, a lot of time it's the sugar, it turns into sugar, and so they're craving. I just found for myself that that's helped. On a personal note, I was gluten-free for about 8 years, like completely gluten-free. And because I did have gut issues, but I had been tested multiple times for celiac, and it came back that I didn't have it. And then I went to Europe and I ate it and I had 0 symptoms, and I was so happy. I got to have bread for the first time in like 7 or 8, well, good bread, you know, it's gluten-free just does not compare. And I've been fine since then. So I think that my gut had repaired or something, but I was just thinking L-glutamine helps with the cravings if it's a craving issue.
Well, L-glutamine is going to help if it's a sugar craving issue, because there can be cravings due to the depletion of serotonin and GABA. But yes, because a lot of people use their gluten-containing foods as their major carb sources. So if you're taking that away and going initially low carb, there might be cravings, you know, well, okay, if there is blood sugar dysregulation and the cravings are for to raise blood sugar, then yes, the glutamine is absolutely going to be useful for that. And then the glutamine in larger doses can also be useful to help repair the gut, as can aloe vera and some other nutrients.
I have a story.
Okay, did that help, Jacqueline?
Oh, yes, that was very, very helpful. And I actually will look more deeply at the question about the sugar craving, because I do have some clients who I do think crave sugar and go the other carb route to get to it. But yes. I don't think this client specifically is. I don't think she's a sugar craver. She's a bread craver.
Yeah. Because you're right, because she's addicted to the gluten itself. And so we can become literally physically addicted to the substance we're allergic to. And I think this woman absolutely, definitely has become.
I agree. I agree. Thank you. Very helpful.
Who had a story?
Me.
Okay.
It's a personal story, actually. 10
We
years
like
ago, I was
those.
diagnosed with leaky gut, and I was rail thin. I couldn't absorb anything. And I know they did use L-glutamine, not as a means to, you know, nourish the neurotransmitter depletion, but to repair the gut, because L-glutamine can help fill in the gaps and the holes that form in leaky gut. And I was just so sick. I don't even know what supplements I was given, but I saw an acupuncturist. I saw like on a weekly basis, 2 times a week. And then I had a naturopath. I saw her 2 times a week. I mean, I was just so fatigued. And, but I was given the right stuff, obviously, because I don't have any issues like that anymore. I slowly gained weight, 25 pounds, and I'm still, I'm not overweight or anything like that, but I can function. I'm clear-headed, but I will say sugar is a problem. And when I took the test, even back then, sugar was a problem. And it showed that I was more allergic to casein than I was allergic to gluten. And I think me stopping that, because I actually had test results that showed that, then I knew right away that this is something that I needed to quit. So I went gluten-free at the time. And I'm just now starting to go back to that because I fell off the wagon, or whatever you want to call that phrase. I never had alcoholism, but I had a very strong food addiction. And I'm wondering, is gluten related to, as we're just talking, gluten related to sugar, but my craving is just straight up sugar, and I'm consuming casein as well. And I, like you said, I crave what I was sensitive to and allergic to. It's very strange. I don't know how that happens, why you get allergic to the things that, why you crave the things that you're allergic. I'm not really sure, but I find that this group is very encouraging for me to get back on track. And I want to be not a person that shares this information with clients, but I want to be the person that shares it from personal experience and say, hey, I went off this, and now I'm much better. I don't want to preach something without practicing it. So I thank you for all the encouragement.
Well, thank you for sharing. And so here's some information. One of the reasons we get addicted to what we're allergic to is whenever we have some sort of tissue insult, a bruise, a cut, inflammation, the body produces both catecholamines, our stress hormones, and the endorphins. So the endorphins and our cats go hand in hand. They're like best friends. Well, the endorphins are internal opiates, right? We really like them. And so we actually become addicted, apparently, to our own opioid production and keep wanting to go for whatever is going to produce it. Because when we fire it, we also deplete it. If we're firing it in great big gobs, then we have to replenish it. This is where tolerance again comes in. And so we use the food to keep firing those neurotransmitters.
How do you deal with the withdrawal? If isn't there something that you can do to help that, or just grit your teeth?
Yes. No, that's where you can use the diphenylalanine. So diphenylalanine is the amino acid we use to help keep the endorphins in the synapse longer, so they have longer effect.
I started taking that actually about a week ago.
Good for you.
So, yeah.
And I would also bring in glutamine.
Yep, I bought that too.
So I would do 1,000 milligrams 4 times a day between meals of the glutamine for the sugar cravings. And then the diphenylalanine, probably 2 to 3 grams a day, just, spread out throughout the day.
Yeah.
And that should take that should help with the addictive craving.
Yeah. Okay. Yeah.
Yeah. Good luck with that.
Thank you. I'll report back any testimonies.
We're always happy to hear testimonies. All right. Other questions or stories? Deborah?
I was going to share this one with the group. Is that this screen is in the presentation that I put in the conversation about Dr. Zach's presentation. And it shows that right about 95, that they started increasing glyphosate that was applied to wheat. And you see in yellow, the incidences of celiac went up. But he will have a graph just like that for soy and for corn that are genetically modified. So when you think about how much of that's in our food supply, and think corn and soy because it's a GMO product, but we think wheat is still, the breadbasket. I live here in Kansas, it's the breadbasket. But we have altered it such with fats, rising yeasts, and how we grind it and how we process it. And now they spray glyphosate to increase the yield, and it's there. And people don't realize that. That's when you read that, when you watch that YouTube I just shared with you, he'll go through how Monsanto is actually an antibiotic, and all these other things are just kind of side effects of how they license it as an antibiotic. And so very little of the actual product gets on the wheat. Most of it's getting in our food, air, and water. I will resend that to you, Kathy, because you came in late. You didn't see it. I'll repost it.
You can also scroll up, Kathy.
Yeah, what's really interesting too is that in dog food, they have the same kind of effect. Like they put crap in dog food, and I learned my dog was allergic to just everything. And I didn't know that until I got her tested. She's allergic to wheat, corn, pumpkin, all of these grains that are the same as what I have a sensitivity to. So it's not just us. I've realized that it's in food for animals as well.
Mm-hmm. Mm-hmm. Yep, exactly. No, this is a very, very widespread issue. And there are dog foods out there that are gluten-free. And some animals absolutely require that, which is just, things have gotten so screwed up. Some of the studies that I didn't mention that are out there, and it's quite easy to Google them and find them, are hospital studies. And, if you take my course, we have all of those references in that particular module. But there are studies where they put, for instance, half a hospital ward, psychiatric hospital ward, on a gluten-free diet. And within a week or so, they're able to start discharging those patients because their symptoms have gone into remission. And then the symptoms slowly, patients slowly start coming back into the hospital because they're so happy being out there, they eat whatever they want, and they expose themselves to gluten, and the symptoms come back, and back into the hospital they go. So they've repeated a variety of that sort of study because, this is really mind-blowing. And they found over and over again that with sort of general psychiatric patients, and it's the problem with some of these studies is that when you read them, you don't know what the specific diagnosis is of the patients. They just say, this percentage of the population, got discharged because their symptoms went into remission. Well, I'd like to know what the diagnosis was and what specific symptoms there were that went into remission. But, people get hospitalized for, suicidal ideation and for intense psychotic symptoms. So we're assuming it's, one or the two of those. But that research has been replicated many times.
Here's this, I can share the PubMed. Someone said they wanted more medical stuff in terms of the, those are the statistics on schizophrenia, AK bread madness that Christina was mentioning, where they bring them in and they get well and then they go out and eat like they used to and they get sick again. So if anybody wants that, just give me a call and I'll send you the PubMed.
Mm-hmm. Absolutely. Okay, anybody else have questions or stories? I'm sure there's more stories out there.
My story is that I was gluten-free. I started cheating with a really good bread that had 22 hours of leavening, which lowers the wheat, and had it every day. And within 30 days, I went from feeling like 52, being 62, to feeling like I was 82. And I was at a conference. I literally, pulling my t-shirt off was like in great pain. Every joint was screaming. And one knee was swollen twice the size as the other. I could only put on flip-flops because my feet were so swollen. And all I can tell you is that, as Christina mentioned earlier, if your body's swollen, your brain is probably also inflamed. And I cannot tell you anything that I went to and remembered from that conference. I was in a complete fog. And it took me 30 days on steroids and changing diet before I even began to feel like I was normal again. So,
a lot of tissue damage done. All right, so we can call it quits if there's no other questions or stories or any other discussion anybody would like to have. By the way, before we stop, I just want to ask anybody, have you had clients with alcohol use disorder who you think might be driven by gluten intolerance? Does anybody come to mind?
I'm thinking of several right now, people that I've talked to that I haven't really addressed the issue of gluten, and I'm going to just ASAP.
Okay, very good.
I've got several people struggling. They're wanting mentally, emotionally, they're saying, I have got to quit drinking and I can't. And I haven't brought up the subject, but I will ASAP. So thank you so much for doing this today, Christina. This was awesome.
You're welcome. Anybody else have any clients? Either just regular clients or addiction clients who you think their symptoms might possibly be caused by gluten intolerance? Or family members?
Yeah, I've got a funny feeling my son-in-law might be actually. I'm sort of consulting with him in about an hour's time, so very, very timely.
All right, so you can bring that up.
Yeah, absolutely.
So along that line, Christina, would the folks that are more likely to be addicted to that would be picking the grain, the bourbons, the grain-based alcohols, the beers, versus they're not going to be the wine drinkers, they're not going to be the tequila drinkers?
I think that's a really good point. Yes, Deborah. Again, we don't know because the research hasn't been done, but I would suspect that absolutely.
Okay, thank you.
So all of you can keep that in mind, especially with your beer drinkers. All right. Well, thank you all for coming.
Just before you go, Christina, can I just mention networking coffee meetup this Thursday? We've moved it to 3 p.m. to avoid morning class for level 2s as well.
All right. Thanks so much, Mark.
Thanks.
And it's great fun, the networking group. So I encourage all of you who haven't been to it yet to go. Have a wonderful Saturday. Bye-bye.
Hey, Mark.